Good morning, Richmond. Good morning. Good morning. Thank you very much. It's indeed a honor to be here with you this morning. Let me begin by thanking the Southside Community Health Center for welcoming me here today. Dr. Boone, your leadership and commitment have made this clinic a beacon for thousands of families in Richmond and across the region. And I sincerely mean that. I'm grateful to you and for your team for the incredible work you do, not just providing care, but giving people hope, dignity, and a peace of mind. To Mayor LeVar Stoney, to Congresswoman Jennifer McClellan, excuse me for mispronouncing that, to our partners at HHS, and to every community leader here this morning. Thank you. Thank you for your service, your vision, and unwavering dedication to the people of this city. And let me just say this, it does not go unrecognized. The work you do here in Richmond is important, is important. And on my administration, the HHS, all of us appreciate every single thing that you do for your community and for the region. And to the nurses, health aides, volunteers, patient navigators, medical assistants, and front desk staff, thank you for being the first face many people see when they walk through those doors. You represent the very best of our nation's spirit. You're the reason I came here today. Let's be honest with each other. For far too long, healthcare in this country has been a patchwork system of winners and losers. If you have good coverage through your employer, you're probably doing all right. If you're older and on Medicare, you have some stability. But for tens of millions of Americans, for working families, part time employees, folks between jobs, small business owners, young people aging out of their parents' plans, and people living paycheck to paycheck, healthcare has been a constant worry, a burden, a source of fear, and a source of debt. Even today, in 2025, people are still skipping doctor's appointments because they can't afford the copay. Parents are still, are excuse me, parents are still breaking pills in half or rationing insulin. Patients are still walking out of pharmacies in tears because their prescriptions cost more than their rent. And there's a story that goes along with this. And it's about, first of all, it's about an educator. And we all know educators get paid way too, they don't get paid enough money for what they do, first of all. Been married to one for 30 years. And she deserves every single dime she gets, if not more. Every educator does. But here's the deal. A few years ago, there was this educator that was prescribed a medication. It wasn't something she wanted, it's something she needed. That prescription cost her $600, a lot of her paycheck. How is that? How is that fair when Big Pharma is raking in billions and billions of dollars? That's not fair at all. And we've made efforts to reduce those costs. And there are people on the other side of the aisle who want to see that eliminated. They want to see you pay full price for prescription drugs. Why is it that way? It's because they have special interest in their pockets. Special interest. The pharmaceutical companies are paying for their campaigns. They're paying for them to be in Washington. And that's one thing that representatives need to understand when they come to the nation's capital, right up to I-95 here. They need to understand that they're elected to represent their hometown and the interests of their hometown, not the interests of Washington, D.C., and not the interests of pharmaceutical companies. And for those folks without insurance at all, it can feel like you're invisible to the system, like you don't matter, like the country you worked hard for has looked the other way. My fellow Americans, that happens all too often. That's not acceptable. Not in the United States of America, not on my watch. I grew up in a middle class household in northern Texas. We weren't wealthy by any means. We weren't poor. We were like millions of American families doing our best to get by. We didn't always go to the doctor unless something was really wrong. Preventive care wasn't a concept we talked about. You went when you had to, and you hoped it didn't cost too much. I remember those days clearly. I remember my mother quietly worrying when one of us had a fever and there wasn't enough left in the bank account to cover an office visit. I remember the worry in the room, worried just about the illness itself, but about the cost of getting better. You should be focused as a parent on seeing that your child is getting the proper medication and treatment they need, not worrying about how much it costs. That memory stays with me. It's part of who I am. It's part of why I ran for this office in the first place. And it's why, as your president, I made fixing our healthcare system one of the central missions of my administration. Over the past 4 years, we have made historic progress. We didn't just talk about healthcare, we delivered on it. We passed the Health Equality and Access Act, which capped the cost of insulin at $35 a month, like I was talking about earlier. Think about that for a moment. Think about that. Millions of Americans, including children and seniors, can now afford a life saving medication that used to cost hundreds of dollars a vial. We empowered Medicare to negotiate prescription drug prices with pharmaceutical companies for the first time ever. For decades, Big Pharma said it couldn't be done, but we did it because patients shouldn't be charged sky high prices for medication that was invented 40 years ago. We expanded subsidies under the Health Care Act, lowering premiums for working families and helping more families sign up for coverage than ever before. In fact, we now have the lowest uninsured rate in American history, something we should all be proud of. We launched the Mental Health Access Initiative, expanding telehealth options, opening new school-based mental health clinics, and bringing emotional and behavioral health services directly to communities in need. After the isolation and trauma of the pandemic years, our children and families needed support, and we're making sure they get it. Even though that's been over 5 years ago since that first reached our shores, we're still feeling the effects today. And we didn't forget. We didn't forget about the lifelines of so many communities, community health centers. Under the American Rescue Plan, over 2,000 health centers across the country received critical funding, including right here at Southside, right here in this very building. That funding helped you expand services, hire more doctors and nurses, upgrade your pharmacy, and serve more families, no matter their income, no matter their background. And this is what gets me. When there was the talk of the DOGE program, of cutting wasteful spending, some of the targets were these programs. How can you cut? How can you cut a program that helps people stay alive? How in good conscience can a president, how in good conscience can a budget director, how in good conscience can the HHS secretary do those things? You know, folks, you saved lives. You strengthened your city, and we're going to keep standing with you. But let me be clear about this. The job is not done. It's far from done. Because for every story of a patient who finally got coverage, there's still a story of someone who fell through the cracks. Because even as we lower prices and expand access, there are still some places in America, right here in Virginia, where basic healthcare services are too far away, are too expensive, are too hard to navigate. We still have mothers dying during childbirth at higher rates than in any other wealthy nation, especially Black mothers. That's a national disgrace. You talk to all the leaders at the G7 summit, the economic summit that we have every summer. We talk about those things. You may not think it's an economic issue, but we talk about those things. And folks, it is a real problem, not only throughout our state, not only through Virginia, not only throughout the country, but throughout the world. We still have a mental health crisis among young people, veterans, and working class men that demands more than lip service. It demands resources, compassion, and urgency. We still have a system where health outcomes too often depend on your zip code, your skin color, or how much is in your checking account. That is not justice. That is not freedom. That is not who we are. So here's where we go from here. We are working with Congress to pass legislation that would establish a public health insurance option so that every American, regardless of income or employer, has the ability to choose affordable, comprehensive coverage. We are proposing a comprehensive ban on surprise medical billing with strong enforcement mechanisms and protections for patients, not loopholes for insurers. We are calling for a new wave of investment in community-based maternal care so that expecting mothers, especially in rural and underserved areas, get the parental and postpartum support they need. And I know that's really important in the hills and the mountains of Virginia. We're doubling down on our efforts to end the opioid epidemic by increasing funding for treatment centers, expanding access to Suboxone and Narcan, and holding accountable those responsible for flooding our communities with painkillers. That's got to stop. That has got to stop. And we're creating new training and debt relief programs to grow the next generation of doctors, nurses, and healthcare providers, especially from under-depressed communities, because America needs a healthcare workforce that reflects and understands the people it serves. This is not just policy. This is personal. This is moral. I believe deeply that healthcare is more about than just access to doctors and medicine. It's about human dignity. It's about economic freedom. It's about whether we choose to build a country that leads people on their own or one that lifts people up. Healthcare shouldn't be a luxury. It shouldn't be something you hope for or bargain for or pray for. Or pray that you can afford. It should be there when you need it. No exceptions, no asterisks. That's what we're fighting for. That's what this clinic represents here in Richmond, Virginia. And that's what I promise, as long as I have the honor of serving as your president. I will not stop fighting for a system that works for everyone, not just the wealthy, not just the well-connected, but for people who do the hard work of holding up this country every single day. and that's the middle class of this country. The middle class of this country built this country. Union jobs built this country. Union laborers built this country. The miners in this very state built this country. To the healthcare workers here in Richmond, to every nurse, every technician, every counselor, every frontline staffer, you are heroes. Irregardless, you are heroes. You're heroes in lab coats and scrubs. You may not always get the headlines, but you're the ones who keep America going. And I want you to remember that. You may not always grab the headlines, but you are the ones that keep America going. To the patients in this room and in clinics like this across the country, I want you to know I see you, I hear you, and every day I'm fighting for you. You deserve the care you can afford. You deserve the respect. You deserve a government that has your back, not one that turns its back on you. And to every young person watching, wondering if they belong in this system, if there's a future for them in healthcare or public service, let me tell you there is, and we need you. Together, we can build a system that lives up to our highest ideals. Together, we can move from healthcare that divides to healthcare that unites. Together, we can ensure that no one is left behind. Not here in Richmond, not anywhere in this country. I want to thank you very much. May God bless you. May God bless Richmond, and may God bless the United States of America, and may He protect our troops. Thank you all very much. Thank you, thank you, thank you.